Okay, so I think we are recording now. My name is Andrea Carey with the North Carolina Coalition to End Homelessness, and I am working out of their data center to support kind of the data infrastructure of Back at Home, but I'm also a system administrator for HMIS just regularly during non-pandemic times. So happy to be here with you all today. I'm not going to mute anyone or monitor that so much. Would love to hear your questions through the mic, through your voice, or through chat. It just might take me a sec to get to chat because it's on like a different screen here. So a little technology run through on the fact that you can mute and unmute yourself using that button in the left-hand corner, either top or bottom. And then there's also the chat that you can use anytime. One thing that is nice about this recording for your colleagues and maybe for your future selves is that that chat will be saved as well. So if there are questions that come up there, it'll make sense in the recording as to what we're responding to. And then if you want to change your name, you can definitely do that as well. Your identifiers there using the participants section and right-clicking on your login there. Okay, so what I'd like to do first is run through our partners, and this project is bringing together a whole bunch of folks and some different data systems too. So just to ground us in what Back at Home is utilizing, how data is flowing, and then kind of your role in knitting together this kind of journey of the client to permanent housing. So we have three main data systems: NC Care 360, Service Point, or HMIS, and the Housing Finance Agency. And there is a little bit of overlapping data in each of these data systems so that it supports coordination in real time, right? You want to make sure you know who you're talking about at any given point. And it also supports the reporting in the near future as we combine all of these data sets. One thing I want to note about Service Point here is that HMIS is a requirement for for most of the agencies, but any victim service providers are required to have an equivalent HMIS data system or comparable database. And we have two Back at Home rehousing agencies that are victim service providers, and they use a kind of off the cloud database called Osmium. So there's kind of another one sneaking in here, but you won't ever see that. That's just for their own systems. Okay, so first, data is gonna, well, and you know what, with you all here, you know that I'm actually missing another data system, aren't I? There's some minimal iCarol data as well that you'll be recording. I know nothing beyond the fact that iCarol exists and that there's some minimal data entry you'll be doing, so I didn't put that in here, but
I think that your understanding and your explanation is perfect about iCarol.
Okay, great. That's it. Awesome. So most of your initial kind of engaging data collection with the client is going to be with NC Care 360, and then you also play a role in HMIS for kind of completing that record of the referral. The Housing Finance Agency is where rehousing agencies are going to be recording their reimbursement requests, all the financial support for the client. You know, looking at your workflow, we're gonna break it down and make it you know, make sense. but also know that those rehousing agencies have an additional data system to work with too. All right. So let's talk about the partners involved in our data system setup and HMIS specifically, since we'll be focusing on HMIS today. So local system administrators are the name of the folks that do kind of the nitty-gritty setup in HMIS. And that just so happens that I am both a local system administrator and a lead agency, but we have 2 HMIS implementations in North Carolina, and so there are local system administrators for Mecklenburg, Cumberland, Nashville, Buncombe, Gaston, Lincoln, Cleveland, Wilmington, the other communities that don't use the same HMIS implementation. All right, so they set that up and we've been coordinating with them. All of the HMIS projects have been set up, so that infrastructure is there and should be complete. Then we have the North Carolina Coalition to End Homelessness. We're the HMIS at NCCEH site lead agency. So that is that second hat that I wear in terms of supporting policy implementation, procedures, reporting for the NCCEH HMIS site. Our equivalent on the other HMIS side is the Michigan Coalition Against Homelessness, or MICA, and they have supported the setup of the project, and then also trying to coordinate some agreements, paperwork, and licensing things for y'all. And then you may also see in some conversations our partners at the Institute for Community Alliances, Abby Burgess and Brandy Yant, have been supporting with how to set up this data flow and specifically reporting. They're working on combining the data from NCCare 360, HMIS, and the Housing Finance Agency. So they're going to bring it all together for us. And that'll be really great for outcomes. Okay, and then for the data entry side, there are 3 main partners. You all at NC211, and primarily you will be, or only you will be looking at data entry for back at home triage and just that entry. Whereas the rehousing agencies, you're going to pass that client to them, and they're going to be the ones to exit the client from that triage project. So they're going to claim them or resolve that referral in HMIS. And then if they are working with that client, the client's agreed to work with them, you know, and net that final eligibility, then they'll start additional data collection for homeless prevention, HP, or rapid rehousing, RRH, services. And then the third kind of wildcard partner is our CE representative. That's a person or a couple people identified for each COC or region that may support clients who you know, can't access 211 for some reason. They're not comfortable with the calling, or they're already being served in the community, and the community has enough information to kind of make that referral. They shouldn't be doing really any HMIS data entry, but potentially as like a troubleshooting thing, they will be familiar with reading at least that entry in the triage. Okay, some principles for our HMIS workflow. I want to make sure that we've set these out because I know there's definitely pros to cons to some of the ways that this is set up, and so I want to establish like why these decisions were made and how we're trying to best support you in connecting with the client and that HMIS and data collection is just a tool as part of the process. So first off, I couldn't avoid that pun, sharing is caring from the CARES Act. Coordination is really essential to our high quality services. And so in HMIS, there's some built-in sharing and visibility so that you as 211 navigators, you'll be able to see if someone has a HMIS entry into back at home rehousing agency. So if they're already being served, you'll be able to see that in HMIS. And then for almost all of the communities, they're also kind of recording coordinated entry services in the community in HMIS. And so you may also be able to see if a client is in an existing shelter or existing permanent supportive housing project in the community. So that visibility has been built in to the extent it exists in the community for you to utilize. All right, so and then another principle is keeping it consistent. We want to make sure that since you all are providing essentially statewide services and navigation, that you have the same structure to work with in each COC. And we've also, to keep it consistent, utilized new coordinated entry elements that HUD requires for some grantees. So it's consistent across the board for y'all. And also for the folks receiving those referrals, right? And then we also have tried to keep it as simple as possible. The triage project is trying to minimize that data transfer from NC Care 360. And the hope in the little far horizon is that there would be an automatic data transfer from NC Care 360 into HMIS. The vendors, the software companies that built both of those sides have begun talks about how they can connect their databases, which would reduce the amount of data entry on you all. That's a kind of, fairly, it's not an immediate solution, right? So I don't have a timeline that I can say with any particular confidence. So I just want to let you know that we're working on that, but in the meantime, we're trying to minimize that data transfer. And then another way to keep it simple is to give homeless prevention and rapid rehousing providers the same standard ESG workflow that they may have utilized before. Okay, so let's talk about the workflow. And then we're going to break it down into some smaller pieces. So don't worry about saying all of this at once. One preface before we get into the kind of visual workflow is that there's some two stages for prioritization for back at home. The first is characterized as this initial surge population, the folks that are in communities right now with existing needs that don't really need to call into another system. They're already known by the community. And so preparation is going on for serving those folks. The lists are being finalized. Some have already been finalized in some communities. And so that data entry workflow is just a little bit different than the stage 2, where this is kind of the ongoing enrollment, where you are that main access point for folks. And that there's just a minimal number of referrals coming through NC Care 360 through those coordinated entry representatives to you. All right, and then there are some prioritization factors for this stage 2 based on lethality and some other housing barriers that households are facing. Okay, so I want to focus on that. So there's a lot of boxes here. Don't be overwhelmed. We're gonna show you exactly where your portion is and what we'll focus on today. So this is a kind of breakdown of how a client engages with the system and where data is being recorded. We start with the upper left-hand corner with either the client calling 211 or they're being identified locally. And then there's that kind of clicker eligibility screen from iCarol, very basic, like, are you in the right county for this? Are you experiencing a housing crisis? And from there, you would enter a person into NC Care 360 and complete the more detailed eligibility and triage or prioritization screen. And there's also that check in HMIS just to make sure that they're not in an existing housing program. We know folks are trying to leverage whatever resources are seem available, and so making sure that that's a little bit coordinated with the community is important. And then from there, if that all works out, then the referral will be sent to the NC Care 360Q, to the rehousing agency, and that same referral recorded in HMIS. And then that third step of this kind of trio in the upper right-hand corner is communicating with the client. All right, so we're not going to go over the NC Care 360 side of this. We're going to start with our HMIS portion. So verifying that the client is not enrolled in another permanent housing project in HMIS, recording that referral in HMIS, and if it's helpful, we can go through what an exit would look like, so you can know when someone's referral has been resolved, and get some information from there. All right, but it's just these kind of first two highlighted portions that you all are really working with, and then being able to read and understand what the rehousing agencies are doing in HMIS for resolving that referral, moving the client into their rapid rehousing or prevention project, and then that housing resolution, how to see that they moved in or avoided homelessness through that prevention project. Oh, okay, so the HMIS side is a little bit streamlined here, and then as I said, you're really working on these first 3-4 portions of this workflow. Okay, so let's talk about a little bit about what we're collecting in HMIS, what we're entering, but I do want to pause for just a second and see if there are questions about this workflow, how you're working in conjunction with those rehousing agencies. Any questions? Feel free to unmute yourself. We can talk or use that chat.
Okay, so so this HMIS system, basically the functions, if I understood this correctly, is just to track the person, where this person or what was admitted into during the past month or whatever, or years or whatever. Is that correct? That will be the goal of the system.
Yeah, great. Great question. Yes, so HMIS records the fact that they had a referral sent, that they were prioritized for back at home services, where they were sent to, right? That regional agency that is providing services, providing that coverage. and then the result of that referral, like if they were actually enrolled, and then details about that household. Because we're using HUD ESG CV, so HUD Emergency Solutions Grant for COVID-19 funding, HMIS is a required portion of their workflow and reporting. But there's also just this is helping transparency within the community. So, you know, there's other programs going on, and making sure that we're using those resources efficiently means not, you know, double serving someone potentially with the same resources, or you know, tracking that history of engagement with the client too. So it's not going to work every time, right? And they may come back. So we'll have that history.
Hey, Andrea, if I can, I just wanted to say hi to everybody. I apologize that I was late, you all, but I just wanted to say hi. And thank you for taking the time out this afternoon for the training. And there will be more trainings to come in the next week or so, but this is kind of the first of all of this implementation. So, and I just want to piggyback on what Andrea was just talking about. So Amanda, Latasha, and I have been working really hard to try to figure out how little duplication and effort in multiple systems you all can do. There is going to feel like some duplication simply because there's just some that can't be avoided. But that is why we advocated for and secured the 2 data specialist positions for this project. So that is why you have that extra person in each of your call centers to help with that and help with some of this duplication of data entry. Honestly, I'm just going to be real candid with you. Nobody wanted to do it. So they said, well, can 211 do it? And I said, well, yeah, if you give us the staff to do it. So that's how we secured that extra staffing. And just because I know that we're reliable and you guys are good at making sure that things are done well and done correctly. So just a little context for you there. But it is going to be some duplication. There's just no way around it, because there is this federal tracking system, and then we'll have NC Care 360 as well, and a little bit in iCarol, but we're making that as minimal as we can.
Right.
So anyway, I apologize again for being late.
No, I appreciate it, Heather. Thank you so much for making those connections too. Feel free to hop in whenever if you'd like for some additional context. Okay. And we will get to the actual system, but I wanted to make sure that we had that context before we dive into those details. Okay, so just a little bit of an overview with what we're collecting. The questions we answer on behalf of clients in the system are referred to as data elements. So let's take a look at what we're looking at for our triage project, which is primarily the domain of you all at 211. So the triage project at project start, which is that intake, that kind of first record of engagement with this project in HMIS. There's some metadata collected, the IDs, the dates, when the referral occurs, all of that. The basic identifiers like name, etc. And then there's the demographics about who that client is, race, gender, ethnicity, veteran status, date of birth, that sort of information. Living situation about, and these are questions around where the client stayed last night and where they're currently staying. What is their living situation? And that helps indicate eligibility, not only for you all, but for the rehousing agency too. So they have a starting place for how to engage the client and look for documentation sources, because you all aren't worrying about documentation or verification of the eligibility. You're giving the rehousing agencies the kind of breadcrumbs to follow. And then some contact information, so that's saved for the household, and they're able to be followed up with, and family unit information around who is being served in this household. Is it one person? Is it multiple adults or children? You know, there's some some additional services that folks may need depending on their family unit. And then the coordinated entry portion is really about that record of the referral, the fact that you all have done the assessment, that eligibility and prioritization assessment on clients, and that this referral occurred. So that's the kind of standardized way that we identify those services for clients, and that will really support both the rehousing agency and the existing community sort through resources and who to serve next. When a client is exited, which you all won't have to worry about, but a rehousing agency will confirm their living situation once they've either accepted the client or there's a problem with accepting the client. They'll confirm that, confirm contact information, and close out the event, the coordinated entry referral. So that is what they will be collecting. And then let's just take a peek at what the rehousing agencies will be looking at when they're actually serving the client. So they have more in-depth information to collect. They're collecting at more stages, so both at the start of those services for either for homeless prevention, and then as things update for the client, they're called interims. And so that as things change, whether that's health, economic resources, or where they're staying, they've got to click that, and then all of that if it's been updated at the end. And again, for the rapid rehousing, it looks very similar. So more in-depth information when they first open up that engagement, ongoing information, including housing move-in dates and that exit. All right, so it could be worse. There's other data that other folks are collecting there. So let's go into the demo for what we're going to be looking at. All right, we're going to be, this is a little checklist for me and you. We're going to be looking for those other permanent housing entries, doing the entry itself, and checking that current living situation, and then also how to search for new clients and entering that data. And along the way, some basic oops moments to avoid. All right, I think that's, okay, great. I'm going to pause here while I talk over to the very beginning, this login screen for us and how we get there. All right, and I'm just double checking the chat a little bit off screen, as I said. So, okay, no chat questions. Any questions so far? Okay. So one thing to remember is that there are those two HMIS sites, and what that, I'm using the term site because it's two URLs, right? Two websites. And so that there will be a chart to view with that identifying, you know, okay, they're in Buncombe, and so it's this website, or they're in Pitt County, so it's this website. But just want to let you know that we're going into the Balance of State and Durham site right now. So that's 80 counties, which is the one I'm the system administrator for, HMIS at NCCEH. So you don't have to memorize this website. I just want to highlight that for you. All right, so you'll log in. We recommend a really secure password, not one that's repeated other places for you, since there's, you know, sensitive client information here. And when you log in, this is going to always have the name of the site in the upper left-hand corner. And then I have a little bit different access, so I'm going to shadow our Helen Housing person here that will be our navigator. And so you'll see enter data as backdate mode.
This is Latasha. Sorry, what are we supposed to be seeing on the screen? Because I just see service point demonstration, so I'm just trying to make sure that my screen is not frozen.
No, I'm seeing the same thing. I'm seeing PowerPoint.
Thank you. It should have switched over, but that didn't work, obviously. So hold on just 1 second. Let me make sure I'm.
If you go, I do this all the time, Andrea, I do the same thing. So in your share screen, pick the one that's actually looks like your computer monitor.
Yeah.
And choose that one, and then you'll be able to enter switch or whatever. That's not a word, but you know what I mean. There you go.
Yeah, definitely. Okay, so I'm just going to log back out real quick. Sorry about that. So this is what the login page will look like. It'll say service point, and then you'll be able to log in. Okay, and so I'm going to pretend to be Helen so that we see something more more applicable. So we've got our HMIS site, the name of this HMIS up in the left-hand corner, North Carolina Coalition to End Homelessness. You'll see that, and then on the right-hand side, you'll see our enter data as and backdate nodes there. Okay, and this you've probably seen screenshots through the videos, but you may not have seen all of this yourself. So the first thing you're going to do when you log in is always go to enter data as mode. So this is in that upper right-hand corner, and what you're going to do there is select the project, select the area that you are the project that you're going to select there. So if you try to enter a client's information without going to enter data as, it won't be able to be seen by the agency that you're trying to give this information to. There's a lot of visibility issues that can come up, and so you really do want to use enter data as mode first. That's just, and this is for both sides. It's always going to be your first step. This will put the data in the right place for the right folks to see. So it's a very important step. All right, let me just pause here for a second. All right, and so remind me, I think that most of us have not been, have not logged into the tech training site to do their practice client. Can folks chat in or just let me know where you are with that kind of practice client?
I think all of Asheville has done the practice clients. We're just waiting to hear back if we've done them right or not. And some of us have gotten an email, but we're waiting, and we're not really sure if we did it right.
Okay, yep. So there's some back and forth there.
And with Derm, it was weird because with everyone completed the modules and they were able to log in, but the steps as far as being able to complete the information in the test, that part did not go so well.
Okay, so we're working through the workflow and those steps.
Yeah, the entry, because with us, I think for also on our side was a little mix up because we also have people training on the actual Lee County, and whenever the steps that we have in our training guide are specifically for Lee County and not back at home. Yeah. So those steps were not quite working. So the Durham folks will definitely need to actually go in and do those practice entries. Okay,
great. That's good context. So yes, I do recommend using that training site for practice, and we'll go through that workflow now. Hopefully this will clarify some of those steps, and there's some other resources that we'll go through that you can utilize as well. All right, so enter data as is that first step, and right now we're going to go into Durham. Our client is going to be seeking services in Durham, so I'm going to select that triage project. Again, you'll have a crosswalk, so I know that NC 502 is Durham. You may not immediately, but we'll have that crosswalk so that you can, you'll know where you are. Key thing that I didn't mean to skip over, but you're clicking on the plus sign when you're selecting enter data as mode. So there's some key kind of symbols in HMIS. The plus sign is the pick me select symbol, and so you'll always want to do that. And then here now you can kind of see those blue letters that run off the side of the page. I know I'm in back at home, but which back at home exactly am I in? I have to hover over that. So not clicking, but if I just hover over it, you can see the full name of that project popping up there. And then if I realize this is the wrong one, I selected the wrong project, I would just click on those blue letters and that exits me out. That is the right project, so I'm going to just go through that manual process again. And the list is just, it's already up here, right? And I can select whichever project I need. Okay, now I believe we're trying to have same day data entry, but of course, if there was a need to time travel to yesterday or any earlier date, this is our time travel button here, backdate. So this allows us to make sure that the data is being recorded for the right date. And so say I talked to our client yesterday and that referral you know, was made in NC Care 360, then we would do that. This is helpful for my demonstration just so I can use a timeline for the client. So just know that you probably won't be using backdate a lot, but if you need to, that's what that tool is. Time travel makes your screen yellow so you know that you are in there. All right, I've spent like 5 or 10 minutes on these two buttons, and there's a reason, right? These are some of the most important first steps for HMIS data entry, so just enter data as and backdate even before you're getting into that specific client information. Okay, next up, let's go to client point. This is where we're going to search for the client, and if the client is already there, we can select them, and if they're not, then we can create that client. All right, so let's go through this search steps. We recommend searching 3 times to make sure that the client is really there. So if I am serving Mr. Solo, I could start by doing the first letter of the first name and then the full last name to search for that client. What I want to do is kind of a broad search that would catch any misspellings. Woo, that's way too many clients. All right, so that's not helpful. So then I'm going to go and try a different way with the full first name and then just the first couple letters of the last name. And again, way too many clients. So that I think I'll just search for the whole name here, and up there is Mr. Han Solo here, client number 4. So you can see how I could search a few different ways. The other way to search for a client that will get you some more specific information is the last 4 of the social. So what I could do is clear out the names that I had there and search for that last 4. And I was just trying to double check what that was, and so then you could search for that. Now on the social, I would recommend using exact match because you don't want the system to search for different orders of that. So then you would be able to find that client a little bit. But mostly you want to search without exact match because, you know, sometimes there's some misspellings, right? So we're trying to find that client. All right, so key things to use to search: first name, last four of the social, if possible, and then we will either select our client, so using those blue hyperlinks below, or we'll create a new client. So if I've searched a few times and there's no client results that matches my client, then I'm going to need to create a new client profile. So I scrolled back up and would fill out the entire name here. I'm going to create Luke. Okay, just to stay on theme here. So I would put in all the information that I have for the client. So that would be, the full name potentially. Alias is really not. I mean, you can use the alias for kind of a street name, maybe a preferred name. We want to try to get the most accurate first name and last name possible. And then this is an important time to make sure that we have our social security number. So adding this in is the time to do that. So you would add the social, this full social, and then respond to the data quality dropdown as well. So if you do have that full, hopefully at least for the head of household, you have that full social. There's definitely places to record that earlier. So we've got that, and then if you have that military veteran status right there, you can identify that too. So now that we have, we scrolled back up, we filled out all the information available, and now I'm going to add new client with this information. You're going to get a pop-up that says you're about to do this, you're about to create a new profile, and are there any possible matches? We've already searched the system for our client, so we know this is the right decision. We're going to click OK for creating this client. All right, a pop-up appears. Because I'm in backdate mode, I'm time traveling to yesterday, I'm just going to say use current system date because I already did that backdate. But this is an opportunity to double check, do I have the right dates associated with this data? Okay, and then immediately.
So one question, so the system date is what you put in there in the backdate, correct?
Correct. Yes. So system date is kind of where am I in the timeline for this data entry, and so that's specific to each client or household. I will say that time doesn't matter quite as much as date. So if you specifically finalize that referral in NC Care 360 an hour ago, you don't need to do backdate mode to the previous hour. Just use your current live date. Did that answer your question? Okay. And moving the spaces up here. Okay. All right, so we've created a new client and we're on the client profile. If I had clicked on Han Solo's profile there, I would have gone exactly to the same place, right? This client profile tab. Now, I want to give us just a little review of what these tabs mean before we go into the data collection here. So we've got a big tab, kind of a parent tab here of client information, and then a service transaction. And we won't be using service transactions, but I just want to let you know those are kind of the parent tabs. And then these second row of tabs is really it's kind of our to-do list. We're going to go left or right through entry exit. So we're starting on the client profile for some identifying information. Then we're going to build out a household, if applicable, if there's more than one person presenting for services. We're going to record the HMIS, release of information. This is kind of the electronic record of that. And then we'll start that triage entry on the entry exit tab. And that's where the majority of our data collection is going to occur. All right, so what's this profile look like? So we've got the client record here. This is our first section. If I needed to update the name, spelling, oh, I got a new alias, I can do that with this icon here, the pencil. This is our second kind of really big icon to use in the system. The pencil is the edit symbol. So whenever you see a pencil, you can edit something. So here I could, if I spelled Luke wrong, I could do that and edit almost anything here. One thing you will see is that this social security number is grayed out. This is not editable by you all or by folks in the system. We can only edit this at the system administrator level. So that's why it's really important to ask for Social Security when you're on the phone with the client. It can be kind of that last part of the conversation, right? We've got some admin things we need to do and record that, but it's important for that first part of data entry into HMIS. And HUD is looking for all 9 digits of that. That's a universal data element that HUD is that HUD requires of our rehousing agencies, and so they will be ever so grateful when you are referring clients with full socials, because otherwise they have to call in all those numbers. So that will be a really, really appreciated part of relationship building with those rehousing agencies. All right, so we scroll down here and we see client demographics. This is where we get some of those basic demographics, date of birth. So unless anyone knows Luke's date of birth, I'm gonna just put in April 1st here. And fill in this data quality type. So again, this is a required part, this drop down, similar to social security number and name that we want to complete here. Gender, there's some options here. We want to make sure that for gender, race, ethnicity, that folks are really self-identifying those to you. And so we would be able to appropriately select that option. And same with race. We've got we've got 5 options here. You can put in a primary race and a secondary race if someone identifies as multiracial. You can put in that second one here. But if they don't identify as more than one race, then you can leave this blank. Secondary race is not a requirement to identify 2 or more races. Ethnicity is considered a separate question for demographics and is required. So you do want to make sure that you're getting both a response for race and ethnicity. That can be somewhat confusing. For all of us. But that is where HUD is right now with data collection and some of the rest of the federal government. So we try to acknowledge that folks can identify how they will, and that we want to make sure they know what the options are. We've got one question for race. These are those 5 options. Another question for ethnicity. There are those 2 options: Hispanic, Latino, or non-Hispanic, non-Latino. On this profile tab, there are options for 3rd, 4th, or 5th race. HUD makes us kind of rank them. So if someone does identify as with more than 2 races, you can scroll down here to select that. Okay, and we are going to be doing a lot of racial equity analysis with this data. So this is really important data collection that you're doing. And then if you scroll down, there's some other information here. You're not going to be collecting any of this information on COVID. This is just a place where you could see if there was contact information selected, but you're not going to need to do that. You're not going to need to do any client notes or file attachments. I just want to acknowledge there's some additional things here that there may be data populating in, but you can continue to the next tab after race and ethnicity. Okay, household. So far we've been working with the head of household, kind of your primary client, but if you have additional clients in that household, you're going to want to go to the household tab to start a new household. If there is a previous household that you could add folks to, you can do that here. But it doesn't matter if there's more than one household. That's not a data quality issue. So as long as the group of people presenting for services is accurate right now, that's what we're focusing on. All right, so I'm going to start this new household. The first question up top is household type. These are, I think, based on some like tax categories. Just pick the one that's most appropriate given your conversation. It's not, it's not the most important question here. So if Skywalker has a child, we could select single parent. And then what we see here is a client search section where we can again search for the next client. It's just like that first client search screen we saw, and they have tried to helpfully put in the last name here. They're assuming that people might have the same last name in the same household. We know that's not always right. So we may use this to search. We may use a different name to search. Let's see. So again, same search criteria. Now, if there's a newborn baby, you know, you wouldn't need to search, but barring a newborn, we'll want you to search in case that client has previously received services. Let's see. I don't remember if, no. Okay, so we've got, I think we've got another, there we go. So we've got Ben Solo here, maybe Luke's taking guardianship. And so I was able to select Ben with that plus sign icon. I can remove Ben with the minus icon, select Ben again from the client results field. All right, and now he's in my selected client section. So in this part, the household, there's a lot of scrolling up and down because you're searching and then checking and then maybe searching again. So just you know, make sure you've got your trusty mouse so you can do that. Any questions around this client search? Same you know, parameters apply. If you aren't able to find the client, you'd be able to, you know, clear out your search history, type it all in, add the new client.
Yeah. So I have a question because when we were inputting these practice things, I believe that they were just individuals, you know, without anybody. So do you need to pass through this and mark it as a head of household, or you don't need to do it? You know.
Great. It's like we planted that question. So great. That's the next step. Thanks, Pablo. Yes, let's go next. So if we finished our household here, we can continue. I do just want to highlight one more thing. If you had a client ID, someone that was already entered in the system, you know, maybe it's another adult, you'd be able to search directly for them here. Okay, but we're done. It's just Luke and Ben right now. We're going to click continue and identify what's going on in this household, who has what role. So we know at this point that Luke is the head of household, but we haven't identified him as that yet. So this is where one place we do that. We say yes, Luke is head of household, and then relationship to head of household automatically goes to self. Awesome. Ben is not the head of household. Ben is, I think we are saying a child. There we go. Okay. So Ben is a child there. And then, so there's these three sections. Joined household is that third section there. And what we can enter here is it populated already with the date we're using. So it'll either be today's date, or if you're time traveling that date, that's great. This joined household isn't like kind of an existential question about when their relationship began, you know, when someone got married, when someone was born to a family or adopted. Like it's just about when are they presenting for services together. So as long as it's either you know, in the past or today, that's great. So we'll just keep that as the 28th for our date right now. You'll notice that there's a previous associations if they've been removed from a household, and then a household count. So Ben has already presented for services with Han Solo, so that is why there's a 2 count there versus Luke. Okay, and that's all we need to do.
Sorry, Andrew, I don't mean to interrupt you.
No.
I don't know if this is what Pablo was asking, but if it's just one person, we don't have to do household at all. Correct?
Thank you. Correct. Yes.
Okay.
Yes. So we don't have to do the household tab at all for a single client. It's just when there's multiple people associated that we would want to do that.
Okay. Thank you.
Mm-hmm. Yeah, exactly. So then we just save and exit there. And now this household is here, saved. That relationship is there. We need to create the group of the household before we can serve them together and make sure their experience of services is all connected in the system. So this is a kind of a grouping mechanism. I'll say that one more time just to be extra clear. Single clients presenting for services alone, you can skip the household tab and move straight to the ROI. Okay.
Andrea, I'm sorry, I have a question. Is there such a thing as a co-head of household? I've seen that terminology in something else recently, and I didn't understand what that meant.
Yeah, not in HMIS. We've got to draw a line somewhere. So, but definitely the head of household is not, you know, based on gender, age, you know, income. It's really about who's that primary client that's presenting for services. So generally that'll be the person that you're talking to on the phone, right? The person that called in.
So even if, you know, let's say the wife is the one that you're talking to, even if the husband brings in the bread, it doesn't matter. As long as she's the one you're talking to, you would put her as the head of household. Okay.
Exactly. Yep.
And I would say we can certainly reverse those roles too. I don't want to gender stereotype there.
Absolutely. Yeah. Yeah. All right. Yep. So we've got to pick one point of contact for the household. So one other thing you'll note here is that under age, we've got Luke, but Ben doesn't have an age. So we actually need to fill out Ben's demographics, and we can do that by clicking on Ben's name here. Or now there's this drop down in the right-hand corner, and you could select Ben there and submit. All right, so now Ben's name is at the top here, and we're going to want to go to the profile where we know demographics is listed. And here we can enter in our demographics for Ben. Let's see. Again, I feel like I'm betraying some, you know, some lore of this theme, but I really don't know anyone's birthday. So I apologize, I did not prepare for that. So then you would select the appropriate responses for those demographics. And if there was secondary races, of course, all of that there. Okay. All right, so now Ben is good to go. We're going to head back to the head of household in order to continue with our data entry, kind of with our primary client first. All right. And you definitely might see individual clients more often, but want to make sure that households make sense as folks do present for services together, right? Definitely the experience with homelessness is changing in these unprecedented times, so you may see more families than usual. Let's see. One other note on households is just that you can edit this household by clicking the Manage Household button. So you would go in there, and if someone was left out by accident, you can add a household member through this button. And the trick here is that HMIS, they're trying to be a little sneaky. They're hiding the search area under that arrow. So you just open up, add clients to this household, and then you've got your familiar client search area where you can, search away to your heart's content, add that client, or add an additional profile as needed. All right. I'm going to exit out of there so we don't mess up that household. And we're back on the ROI. So the ROI is going to be a verbal ROI, of course, because you all are talking on the phone. And you're going to want to make sure that this occurs as you're on the phone with folks, so that either you or the data specialist can record that consent. Make sure that you're selecting all of the appropriate household members. So now that we've created this group for the household, Ben is there ready to be connected. We've already got our project entered here for provider, so that's great. We'll just go down for release granted, yes, and then the date. It sounds like maybe a couple folks have previously worked in the Lee County Coordinated Entry Project, and the verbal consent was a little bit different there. It is now 1 year, same as the paper consent. So we can just set that to next year, same time, 2021, can you believe it? 365, 366 days, that's 1 year, that's considered 1 year. So this is appropriate. If you want to do, the day before, that's also fine. You'll notice that I clicked this green check mark icon, and I was able to go, it just entered today's date, and then I just had one character to change. You can do it that way. You can clear the date with that blue arrow, and then you can also use the little calendar icon here to select the date through that kind of box format. Documentation will be verbal consent. And if you can put your initials there, just as you're the person that did that, that would be great. All right, just for that record keeping there. Questions about that consent? Okay, let's keep going with our standard entry exit. So we're going to go to the entry exit tab and add entry. It says add entry. Yeah.
I have a question about the consent. Sorry, I couldn't find my unmute fast enough. It's a kind of in the weeds question, but do we know where the consent is going to appear when we start back at home? Like, do we think it's going to be something that they're reading in 360, or, like how it's initially proposed is that the navigators are doing the 360 and then our data people are doing the HMIS. So I was just wondering if the ROI verbiage has been thought through as to where that would be.
Gotcha. Yeah, so let's see. As you're identifying, it's important that the consent conversation occur as the client is talking to you, right? So as a navigator, you would have that advantage of having contact with the client versus the data specialist. So it does need to occur when you are on the phone with the client. I don't have specific guidance for like when exactly in the conversation, but I would recommend that be integrated at that point, so that you're giving your data specialist the ability to move forward with data entry.
Okay, so basically the navigators at some point will be reading it to the client, and then that's when it will be going to the data specialist. Okay, perfect. Thank you.
Yeah. Okay. So I just want to make sure you guys can still see my screen. So we're on the entry exit tab, and now we're going to record this referral by adding an entry for our triage project. Again, we've got this household up kind of at the top. We want to make sure that everyone who is entering, who is seeking these services, is selected there. You'll see your provider is set to your triage project that you selected in the beginning. And then the type, this entry type, it's always going to be HUD. We're using HUD funding for this, so it's always going to be HUD. And then your date should pop up immediately. You shouldn't need to edit any of that. Save and continue to get to the questions. And so I'm scrolling down, but just going to let you know, this just repeats a bunch of information at the top. It's a summary of the household, a summary of the project that you're entering. So we're going to scroll down to the good part, the questions here, and you'll see entry assessment there. On the left-hand side, you'll see a list of household members. If there's just one person, it'll just be, the one client there. And if they have a household, it'll scroll down, list down there. And this is how you could switch between household members to respond to their specific questions. Let's start with Luke though, and look over here for our questions. This is titled Back at Home CV Triage Entry Assessment. So you know you're in the right place. We are looking for our COVID triage entry. All right. And some of the responses from our profile will be there already. It's still important to enter those on the profile tab for some reporting. It kind of matters where that data is entered. So it'll just pop up here as a reminder. And then you'll see the next question is relationship to head of household. We're going to need to respond to that for every client. Luke is the self head of household. And apologies, I missed this, but you'll see headers indicating what information needs to be entered for each client. So this is for all household members, including Luke. And here is the NC County service, where are they seeking services. This is all of the counties in North Carolina, so there are 100 counties, but you can use the keyboard to kind of jump down to different letters. So that may be a shortcut for you. For Durham, I can go to E and then just go one up to Durham. So little shortcut there for you. And then everyone also needs this question: does the client have a disabling condition? Yes or no. You can say no there. One other thing I'd like to share with you is if you hover over a lot of these questions, these data elements, you'll get a little pop-up of explanation. This is referring to HUD's definition of a disabling condition, so that is there. All right, and then our next section is for adults and heads of household only. So this is Luke here, and we'll respond to domestic violence victim or survivor. If it's yes, then you have these other two questions to respond to. When that experience occurred, and are they currently, experiencing homelessness or about to experience homelessness because of this situation? And so you could respond as appropriate there. If this first question is no, then you can skip these two questions. All right, and then next up, prior living situation. These are divided by categories into the different situations. We can say place not meant for habitation there, and some follow-up questions occur. These questions are already all listed out in either NC Care 360 or the documents. So you should have this information to enter. Just to kind of relate what these questions mean, prior living situation is really about the night before, where did they sleep and for how long. So we've got some different options here. Maybe it was a week or more, but less than a month. And then the approximate date homelessness started is really about when did this experience of homelessness start. So it's possible that, Luke was outside, but before that he was in the car, before the car was stolen or totaled or something, and so it could be a couple things there. This is you're probably collecting this data fairly quickly. You're not going through maybe kind of as deliberately as maybe the rehousing agency will. I want to acknowledge that you're getting information as efficiently as possible, but just want to explain what this all means. All right, and then there's a couple questions here under prior living situation about in the past 3 years, what's the number of times the client has been on the streets or in shelter, and this is including this time, right? So if there was another time, it would be two. And then the number of months, so how many months in September, and then maybe last January or last December, so that would be 2 months. Housing status is that category of homelessness, and it's kind of all described there, but we've got our literally homeless, imminently at risk, or fleeing domestic violence. Those are the three kind of qualifying categories there. All right, and then this may be the same as their prior living situation, but we also have to enter in a current living situation, which is, where are they staying right now? First up, we've got too many dates, so we're just gonna put in the same date for all of those. This should just be kind of all the same to complete this moment in time of this observation, this response from the client. Then we go to our current living situation drop down. It's the same thing. So, Luke is still searching for housing. We weren't able to connect him to shelter. He's still outside. So there it is. And then for living situation verified by, you're just going to select yourself. So we're going to go to the lookup. And right now we're acting as the triage project. So I can search triage. You get all those glorious triage projects. I can search for the specific project ID number. Let's see. Search there. Kind of etc. So I'm going to select my 502 project here. And we're working on getting that a little bit easier to read, to have it kind of line up with how we viewed our project up top here, with, you know, the back at home symbol, the dashes, the number at the end. But that's what we've got right now. So you can definitely search. Oops, oh, too far. There we go. So search for that project, enter that there with that plus sign, and then is the client going to have to leave their current living situation within 14 days? This is really about those category 2 folks. So right now, I mean, he doesn't have to leave outside, but if Luke was in a place with a friend, that's when we would say there's whether or not they have to leave within those 14 days. All right, then there's some follow-up questions if they are going to have to leave within 14 days. So this is if folks are imminently at risk, then you would complete those questions. Again, you would have already seen these questions in NC Care 360. All right, so we're gonna save that. And then we've got this record here. This moment in time is identified as place not meant for habitation on the 28th. And that's where Luke was. Okay. And then we've got our final section for heads of households only. Client location is the COC. So that is going to be Durham for this example, you know, but it could be down to state. And then you'll have your other ones there. So this is going to be the same kind of number as is in my project name up top, right? We had 502 there. So that's the client location. And then if we wanted to add our client information, contact information here, we could. So this is a text box. So, you know, you can type in the number with whatever formatting you want. And you can leave that end date open since it's still available. If you find out, you know, if the client's like borrowing a phone or something and it's really better to kind of meet them at 4th and Main Street, you can write that in this other contact method. So potentially a client, you know, on the streets wouldn't have consistent access to a phone, and so that's where you could put that. All right, so once you save that, you can see that pops up there. And then we've got just some family unit stuff. I've apparently made Ben an adult, so I'm putting him down as 2 adults with 0 children. And then we've got to record the referral, so coordinated entry assessment, same day start, and our location is 2-on-1. Our type is on the phone. It's the same every time. It's a housing needs assessment, and you've placed them on the list. The fact that you're even doing this referral means that they were placed on the prioritization list. They have been prioritized for back at home, right? So these responses are going to be the same for you in HMIS every time. Phone, housing needs assessment, placed on prioritization list. And you're 2-on-1, obviously. All right, save that. And then add coordinated entry event. There's some weird conditional logic here, so that's why it's so long. So just keep in mind, we'll go through this. So start date, end date, date of event, it's all the same. We're doing this. So this is the referral. The event is our referral. There's 2 options you may select here. Referral to prevention assistance or referral to rapid rehousing. So other folks in the community are going to use this for some other referrals. But for back at home, we've just got the 2 resources. Prevention, if it's possible, you know, you're not quite literally homeless yet, and rapid rehousing if you are. And then there's a little bit of this kind of conditional logic. So if the event is a problem-solving intervention, you do this. If it's a post-management, we're not doing any of that. So we're scrolling down to number 3 here, section C. We've got if event was a referral to emergency shelter, transitional housing, joint transitional housing, rapid rehousing, or other permanent housing opening, please respond here. So this is our spot right here. We're gonna select the project that we've referred them to. And so in HMIS, that's really which rehousing agency are they going to? So in Durham, we can do Housing for New Hope. Again, you would like have the ID there. We could just type in the ID for reference, so it's nice and easy. You don't have to search too hard. All right, so we've got Housing for New Hope there, and then you don't enter this other information. Housing for New Hope is going to come in when they exit the client and say whether this was successful or not.
So Andrea, 2 questions. We're mainly doing like the entry, right? Like we're never going to exit someone.
Correct.
And then the agency you just put in there, that is where they're being sent. I guess just from a workflow, before our navigators give it to the data specialist, they have to know where they're being sent so that the data specialist would know to enter it, but we can't technically send it until this part's done, right?
Well, I think we can talk through that timing a little bit.
Okay.
Because what the navigators are doing is completing the NC Care 360 assessment, identifying the priority level, and then it's the specialist that is matching that priority level and that county location to the right rehousing agency.
Okay.
Unless,
Yeah.
I mean, I may have misunderstood.
No.
No, I think that's correct.
Yeah. So
Yeah.
I think that would work. And then, so technically the data specialist would be the one like pressing the send button in 360, and then it would all work nicely. Okay.
But Amanda, do you remember, did we decide who was going to communicate it back to the client though? Because I think that's the hiccup there,
Yeah.
right?
So we would do, using Gary's name since he's the data for Asheville. So Gary would do all this HMIS magic, send to the housing agency, but then would reassign it to the navigator Pablo, and that would indicate to Pablo that he's telling the client where they were sent to. And then Pablo will see where Gary sent the client.
And all of this is in real time.
Yeah.
It's not in real time. No, it's not in real time. Because, and that's the thing, that there's going to be a delay. Like we knew that, right? Because we knew that this couldn't happen on the call, and that's why we broke it into 2 pieces.
Yeah.
Because Pablo can't do all this on the call while the person's there. That just does not make sense.
Right.
So Pablo has to do the piece he can, finish it, send it to Gary. Gary does his piece, but I think that's where it gets sticky. Like,
right. Yes.
There's gonna be a lot of. I'm guessing that we will have a lot of the sort of a follow-up thing, in where we have to talk again with the client.
now, ideally, if the client can give us their text or email preference on the front end of 360, which they should be able to do, then you, Pablo, would say to the client after you do the assessment, all right, so this is now going to another person on our team who's going to finalize everything for you. You will then receive a text that's going to tell you the next step in the process. And once Gary checks all the boxes and checks for all the duplication in HMIS, Pablo probably will have already figured out what the referral is. Like he knows geographically where we're going to send this person, but we don't want to send them until Gary makes sure there's not a duplication. So then
Mhm.
once that's done, does it matter if it's Gary or Pablo who sends it? I don't think it does because it's coming from 360.
Right. And yeah, it wouldn't identify which one it's coming from,
Right.
Gary or
Right.
Pablo sending it.
Right.
So it just depends on whose like workload is higher,
Which
So,
honestly, I think is going to be Gary. Sorry,
Yeah.
Gary, it's looking a little rough. And I think, is it DJ? You're the
Yeah.
other data specialist, so it's looking a little rough for you
Yes.
guys now that we see it all played out. I think this is also, keep in mind that we're looking at it very slowly. I think once you get into the, into the motion of it, it's going to be click, click, it's going to be faster.
And that's what I was telling Amanda. It's like right now it seems so convoluted to me because
Yeah.
I don't know who's doing what from where and when.
Mm-hmm.
So I'm trying to like learn the whole thing, but I feel
Right.
like it's not going to be as complicated once we actually start
It's
doing
not.
it.
Yeah.
And I know those steps, it's going to go really quick.
And I think the other thing is, there's going to be a handbook for you, and you're going to have your piece that you refer to and say, okay, this is the part I really have to know. I want to know the
You
whole
just
thing.
eased my mind because I'm just like so lost right now.
You haven't memorized all this, Mary? You don't have this committed to memory? Come on.
I'm just like,
No,
okay, I'm just, floating in the void.
No, you're gonna be okay. We're not gonna throw you to the wolves. We're gonna make sure you know what you're doing and you're comfortable.
Mhm.
We're all gonna be learning a little bit as we start this off, but
Yeah.
Yeah.
but you're not gonna be expected to know every bit of this right from that moment. So
Yeah.
I do think though, like we need to, and Latasha and Amanda and I will rework that probably with Andrea's help of like figuring out that close the loop piece. Because really the client doesn't have to do anything else, right? Once you verify everything and make that referral, they're just still waiting for that
Right.
agency to contact them. That's the beauty of 360 is that they'll be contacted. So it's really just saying to them, you're going to get a text that's going to tell you who's going to contact you, but you still don't have to do anything else right now.
Right.
You just get to
So the question that's coming to my mind is, I know a little bit about NC360 because I was doing some of that anyway.
Mhm.
Are the navigators going to be able to get all of this information for HMIS
Yes.
that I'm going to transfer over from NC360? Right?
Yeah.
Okay.
So we've designed it to make sure that you have everything you need as a data specialist.
I gotcha. Okay, because I haven't seen it in a few months, so I was like, I don't remember it being all of this
It's not. So
information.
there's a special assessment tool that's been created, Gary, that actually has more
Gotcha.
fields in it. So it's not your normal intake in 360. It's a more
Okay.
comprehensive tool.
Oh,
But
that
that's
explains it
good.
too.
Yeah.
Thank you.
Yeah.
Yep. Thank you.
And just how
Haley?
it's out is we're doing the HMIS training first. I know it's a little out of the
It is,
timeline.
but it's the box we could get checked first. So we're just like
Mhm.
going for it, get something off our list. Kaylee, did you have a question or comment?
I know that this is going to be like you, Latasha, and Amanda thing, but I used to work for the housing providers,
Okay.
and I know that the text and email is going to work best if we
Mhm.
can get that and if it's safe for them to do that, because we're going to get a million calls back. Have you called? Have you done this?
Oh, I
If they
know.
have it
Oh,
on
yeah.
the phone, then they're like, because that's what we started at our agency. We started doing text and email updates. That was my part of my job there,
And-
and that was
yeah.
a lot easier and faster for us because you're going to call them and they're going to be like,
Then they want to talk. Then they want to talk and tell you their whole story again. So one of the questions that we've posed to the 2 state agencies for this program is, what is the initial time frame you want to give? So they'll get an initial text or an email that will say, this is the agency you've been referred to. There is no need to call 211 back unless you haven't heard from them for, I'm thinking like 10 days, honestly, at the beginning, because at the beginning, it's going to be just such a surge of volume. So I think it's realistic to say, unless you don't hear from somebody for 10 days or 2 weeks, please don't call 211 again. And also don't call that agency. And we're only going to give them the name. We're not going to give them the phone number because they don't need to know that.
Right.
They can
They
find
just
it
need to
themselves. Yeah.
Yeah. There's communication pending, right?
Yeah. Now, if you haven't heard from them in, by 15 days, then yes, you should call 211 again because we're going to look into it and see what's happening. And it may be that that's just how long it's taking. But we at least then can hopefully manage expectations of not saying, like, if you don't hear from them in 24 hours, call us back. Well, you're not going to hear from them in 20 hours. It's not going to happen.
Andrea, I'm not sure if this is the place for this part of the training, but I'll ask it in case it is. But so Pablo does the initial assessment, sends it to Gary. Gary looks in HMIS and he finds something that's like a red flag that the person can't go forward. What exactly would they be finding that's like the red flag that they couldn't go forward, or like additional information is needed? Again, if this isn't the right time for that question, completely forget I asked it, but I know that that's something we've been struggling with, is like, what exactly would be there and what kind of follow-up would we do if we found whatever it was?
Great question. I'm going to put a pin in that for just
Okay.
a moment and close out
Great.
this in, and then we'll see exactly what you would see
Okay.
if they have already
Perfect.
called
Thank
someone
you.
or already being served in the community. Yeah, great,
Okay.
great question. So yeah, I am glad we paused. I know that was a lot. So you'll know exactly where in the recording to go to for that. But I do want to just make sure we're completing this project entry with all of the household members. So Luke is our main focus, right? But we want to make sure that there's some information about Ben as well. And like Gary said, this is already going to be collected for data specialists. So you're going to click on the other client's name here in this kind of household member section. All right. And so you click on them and then they turn blue. And now we've got their kind of assessment here. But they're a different person, right? So they have a different relationship to head of household and a different age. So we just head back to our headers here. We've got all household members. So we are going to need to select relationship to head of household. We are going to need to select our county. We are going to need to select our disabling condition response. And then we scroll down, is anything else applicable for this person? Well, because I've forgotten what year it is, Ben is an adult, so we are going to select some responses for him here and continue these questions for the adults. So I do want to emphasize that those other household members are important. And you know, it's again the same questions. We've incorporated this into the data collection piece for NC Care 360. All right, any questions about the meaning of these questions? Because I know data specialists, you're mostly not, you know, in HMIS, but these are similar questions to what you'll be looking at.
Probably
okay,
said
I know it's a
before,
lot.
you probably said before and I missed it, but what are all those blue G's? Does that mean it's required, or is that like give more information?
Yeah, I can remove the G's from, well, not in the other HMIS site. The G means add a goal. It's just an option.
Okay.
So at any data collection point, you can say, oh, there's a goal to change this for a client. It's kind of a case management tool. So don't worry about it. You're not gonna, awesome. You're doing your assessment piece of the client and passing them along to a case manager. So you don't need to worry about the client's goals.
Perfect. Thank you.
Yeah, great question. Okay, so again, this is a little bit faster now. You can see how that might speed up a little bit. Okay, so I finished that adult data collection, so I'm going to leave the rest here, and I can go down and save and exit. Just a heads up, save and verify is the system administrator tool, so you don't want to click this button. You're only going to use save or save and exit. So I did not respond to client location for Ben, but I know Ben is not the head of household, so I'm going to say I don't need to answer that question and just continue. Okay, I think my alarm service has passed. I'm going to put this back on speaker. So now what we've got is our start, right? The project start date is here. This is the kind of recording of that referral, but there's no result to the referral. So there's no exit date here. In the entry exit tab, when clients engage with projects, they'll have a row for different project engagements. And so this kind of section here, this program name, would tell you what kind of project they've either previously engaged with or maybe are engaged with right now. And you can tell whether that's current or not based on if there's an end date, an exit date here, and then of course when the start date is. I'll show you a kind of fuller entry exit page that you would check for other program entries, but also wanted to point out this client section over here. If you click on that magnifying glass, you get a little summary of which household members are included. So if you're trying to figure out, oh, well, was someone missed here or there or something, you can do that. Great. So let's see. We're going to think through the situation where you are searching for a client and you find them in the system and you're checking to see if they are already being served by another agency or another program. So I'm going back to Client Point to our original search area and just going to clear this out for Luke. We're gonna search for Han Solo. I know I'm looking for this exact person, so I'm gonna use that exact match button. And there he is right there. So I click on his name. So imagine we're doing that initial search. We found someone in the system that looks like a match. So we're going into their profile, double checking, okay, yes, it's the right age, right? We've got similar demographics. This looks like Han. And so now I'm going to check and see if Han is currently being served in the community. So I can actually skip right over to this entry exit tab in order to see. Now I've done a lot of testing and training with Han, so he has been very active in the community. So what we look for first, I think this is good because you don't need to be, you want to start at the top, right? So there's a row for each project entry, and what we're going to do is we're going to start at the top. And we look here and see, oh, there was a rapid rehousing project that they're enrolled in, but the exit date has already happened. So they're no longer enrolled in that. And so this is actually no longer, applicable. I can't maybe refer them back to that program because that, for some reason, that relationship ended. An example of an open relationship would be this one here, this row here. So here, there's a street outreach agency that seems to have a relationship with the client. But maybe it's a little bit old. They saw him in July. I can actually go into here into interims and see whether they've seen him recently. Oh, they entered a review. They entered a contact with the client on the 19th. Now, street outreach is not permanent housing, so I don't think that would stop you from completing the referral. What we're looking for to stop a referral is really rapid rehousing or permanent supportive housing, right? Because those are kind of equivalent services that we don't want to duplicate. So I'll say that again. So it's rapid rehousing and permanent supportive housing that are those duplicative services. We don't want to, we want to press pause on the referral if we see that. Not that like they can't be back at home clients, but it's probably best to make sure they check in with their case manager. Let's see. I think the main
Andrea,
thing.
oh, sorry, yeah. I'm so sorry. you may be about to answer this, but so if I'm getting the information from the 360, I'm putting it into HMIS, I see that they have an open one for either rapid rehousing or permanent housing. Do I contact the navigator and say they're already getting services? How does the caller know that we've checked on that and
what's
that
the
we
best
can't add them
communication?
again? Yeah.
Yeah.
Text and email?
Amanda,
Would that
is
be
there a
easier?
way?
Yes, we were thinking like with an example like that, you would like reassign it to Pablo, and then so Pablo would know the questions to ask Joe Smith. So to ask, are you still with this rapid rehousing program, or what do they know about that rapid rehousing? In terms of though, Andrea, if like Joe Smith's like, I've never heard of that agency, do you have suggestions on like the best next step? Like, if HMIS is telling us a story that Joe Smith is saying is not accurate, how would you suggest we do the next step?
Yeah, I think then the next step is to reach out to the CE representatives in the community and say, I'm flagging client 4 for you. They seem to already got them through 211. They seem to already have a community connection. And so that would probably delay the referral, you know, a little bit more, just to set our own internal expectations. But this is where you get that client ID, and that client ID is okay to email, right? Because the CE representative has HMIS, so it's not identifying information. And so I would utilize that to say, can you double check this? If possible, it would be great for that to be a phone call, but I don't know if that's really in the capacity. And
So
in the initial stage, everyone should have an open entry because they're being taken from a list in the community. So we don't have to worry about that for at least October.
So if Han, for example, when Pablo talks to him is like, oh yeah, I just didn't realize that was what I was in, like, is there any follow-up we would do in HMIS, or Han knows how to connect them, he just thought that this was a different program? Like, is there any kind of follow-up we need to do, I guess?
No, there's not kind of required follow-up there. I mean,
Okay.
We have limits on energy and time, so that's not written in.
Okay, cool. So we would just do a follow-up if Han's like, no, this isn't right, or like, I haven't heard from them in months or something like that. That's when we would do the follow-up with the housing agency.
Yeah.
Okay, cool. Thank you.
Okay, those are the main highlights. Question. I can also go through some of the resources.
So that's the high points.
Those are the main high points. Yep. So that's how you enter that, and then that's where it stops, right? So it's not.
So now Gary's gonna do one. Gary, can you share your screen?
Ha!
I'm just kidding. I'm totally kidding.
I needed that laugh today.
We all need a laugh right now every day. I understand.
The other question that keeps spinning in my mind that might have been answered, but as far as like, you know, who I will be referring them to, how do I know that? Is that coming from 360 or is?
That's in the 360 piece, right?
Oh, okay. All right.
Andrea, I think, yeah, that's not going to be in here at all.
Oh,
Yeah.
so I'm literally just putting everything that 360, like it's all going to be done there, and then I'm just adding it on here.
Yeah.
I gotcha.
And checking for duplication.
Right. Okay.
Yep.
I'm done then.
Yeah,
I know everything.
Yeah. There you go. Check. Yeah, I mean, again, this really comes down to there was going to have to be some dual entry of data. It's crummy. We hate it, but That's why.
I am very grateful for the data specialist. I love doing that. So
Well, there you go. And
I'm golden.
we love that we have people on our team who this works well for them. So this is great that you have your niche now. So yeah, this is perfect. So what's the smart sheet about there, Andrea? Do they have to do something there?
No, you don't have to do anything here. I just thought it would be, just that there are resources and guides, right? So there's the handbook with some step-by-step directions that we're updating, and then I wanted to show us the let's see, this training and other trainings are posted on the training site. Down towards the bottom, my data collection gets relegated to the bottom because we're client centered. So we've got our HMIS forms here. This is the paper packet that folks are utilizing now. And you guys are only doing this start assessment for the triage project, right? There's the cheat sheet, which is it's basically the steps in the guidebook but taken out, so you can go right there.
So does that have screenshots and it's like do this, do that, then do this? Is that what the cheat sheet is, or?
Yeah, it's pretty specific. I think we're trying to add our screenshots. They're not screenshotted yet. But yeah, so this is posted, right now. Apparently the internet is slowing down. So I did want to show us that. And then in terms of the NC Care 360 forms, we talked a little bit about how there's some information that is kind of the admin collection at the end of the call for HMIS. And this is the NC Care 360 HMIS supplemental form. And so this is the stuff that we couldn't get in the NC Care 360, basically. And so this is the document that our navigators will need to upload into NC Care 360 to have for this. So we can't get NC Care 360 to change all their gender options. So we're just confirming, the gender there. This head of household one is
Oh, so this is like an actual form that they're going to complete separate from the 360 intake?
Yeah, so just to make sure that you have everything collected, like, social, you want to make sure that that's there, so that's uploaded for that. It's mostly about the other household members, because Care 360 is so kind of primary client focused that we couldn't have it capture everything needed for those other household members. So anyway, so this is the adult template and then the child template.
So
this
one question I have about that is the social. So are we actually like saving a form that has their socials on it, and where are we supposed to be saving those? Because that worries me.
Yeah, uploading it to the NC Care 360. They have their upload section.
Right, but to upload it, you have to have saved it somewhere, right? Like you have to save it as a file. And so, I mean, other than them saving it on their desktop, which really makes me uncomfortable, I don't want to put that responsibility on anybody.
Deleting.
Yeah, that's concerning.
Let's talk about.
Let's talk that through tomorrow. Yeah.
Yeah.
Because I mean, and this just goes back to, I remember when we had the conversation with Aaron, early on when we started to do coordinated entry, we really only wanted to do the last 4 digits simply because it, in a call center environment especially, and please, none of you guys, it's not a matter of not trusting you. It's just, for me, for you to jot down somebody's social or do anything like that, we also wouldn't want to give ours to somebody, right, over the phone. I wouldn't. It goes against everything we teach people. So I would wonder, Andrea, if we could even do the last 4, and then when they're with the housing agency to actually finish all the compliance documentation. But that's a correction, isn't it? Then it becomes a correction. And I think that's the hang up.
They have to call us. So That's just not where HUD is right now with their consideration of social
Oh, I know.
security number.
They don't care. They don't care. It's horrible.
Yep.
It's
So when
horrible.
we have
to
our
me.
extra time, I'll sign on to that petition. I will work. Let's give HUD our feedback about that.
I will, and you tell me if I can do it, I'll do it too, because I think, you know, more and more 2-in-1s are doing this, and if we need to put out a message to our network to all do that, because I just think it's inappropriate for us to be asking people to do that over the phone. It's not a smart thing to teach vulnerable clients to ever give that kind of information over the phone. And I also think, you know, from a liability standpoint as a 2-in-1 system, I don't want to bear that liability, that if we ever did have a bad somebody in our mix, that they would have access to people's social security numbers. That makes me incredibly uncomfortable. It's just not a good, and so I think that HUD is just still stuck in the dark age and not recognizing that some of this stuff is happening, you know, the way people are now interacting and entering the system could be through phone, could be through a web referral, things like that. So whatever we can do to add a voice to them acknowledging that times have changed, we will gladly do. But please, team that's here, not saying I don't trust you guys. I just think it's wrong to let people give that information over the phone. I know.
Yeah,
I
we're
would,
putting
but
client shoes for sure.
yeah.
So we've gone through a lot of stuff. I know that was a lot of information, and we're happy to answer questions. I think taking another look at the training site, even if you've done that client profile already, take another look there, try to do another entry given our training today. It's not required. I'm just suggesting.
No, I think that's so this smart sheet and this site that you have here, can you put that link in the chat? Can everybody on this call access that, or do they need a sign in, or how does that work?
I think I need to send that individually, that invitation to folks individually. So I have everyone's emails, I think, from this meeting. So I'll, I
think that if you can give everybody access to that so that they can go back to these resources and be looking at it and getting it more ingrained in their minds. And again, keeping in mind that this is just one piece of kind of this trajectory of a process. So more to come, but I think this is a really critical piece. So thank you for taking the time today to provide such a thorough training.
Absolutely. And
yeah, go ahead.
Just want that, before we really see NC Care 360, these paper forms replicate what you're collecting in there. So it's possible that.
Yeah. So Gary, that'll probably be helpful for you or anybody who's worked in 360 to see, yes, this is a lot more information than what we normally ask.
Yes, no, I really appreciate what you've done today, Andrea, because it was difficult not knowing what the aspects of what I was doing was. So this has helped a lot with all these questions, and Heather and Amanda, thank you. So yeah, I appreciate it.
Well,
I'm back
all of
now,
you
no more stress. So I'm like, okay.
Oh, you're stress-free now. That's awesome.
Yes.
Good for you.
The excitement is way higher than the stress, let me be honest. So
cool.
Yeah.
Well, you guys are going to be
a learning curve.
A fantastic team statewide working to help so many people. So this is just an exciting thing. And I'm really proud of all of you for stepping up and taking this on. And more to come, lots of more information and training over the next week or so. And hopefully get this launched in a couple of weeks. So we have a little bit of an update on that. We still don't have a date, but it's not happening in the next week, which is the best news yet. So we're excited and relieved about that. So you have more time to focus and learn and get the training that you deserve to be able to be successful in this work. All right. Well, thanks everybody for your time today. And Andrea, thank you for such a great training. We'll see you tomorrow afternoon on our other call. And everybody else have a good rest of the week.
Bye.
Thank you.
Bye.
Bye.